Hello, I'm Dr. Craig Childress. I'm a clinical psychologist in Pasadena, California. I specialize in working with children and families around issues of attention deficit hyperactivity disorder, parent-child relationship problems, angry, oppositional, defiant children, marital problems, things like that. In this video series, I've been discussing a particular type of parent-child relationship problem that I refer to as a parental alienation dynamic. And in this set of video segments, I'm going to be discussing the origins of the parental alienation dynamic in a process that's referred to as the transgenerational transmission of trauma. Now, this concept of the transgenerational transmission of trauma is a well-recognized concept within the field of early childhood mental health, although it's less well known outside the field of early childhood mental health. And that's primarily because of a lack of education and training with regard to child development and the neurodevelopment of the brain in childhood. And I'll discuss that in a second. But within the field of early childhood mental health, there was a seminal article written by Selma Frailberg, which she entitled Ghosts in the Nursery, where she spoke about how the childhood history of the parent's own childhood history, formed certain relationship patterns or trauma networks that were then transferred to the parent's own child through relationship patterns that the parent adopted with their own child. That the parent's own childhood history served as a ghost within the relationship patterns she has with her own child, or the parent has with their own child. So ghosts in the nursery. This transgenerational transmission of relationship patterns has also been widely studied with regard to the attachment system, using an instrument called the adult attachment interview, where they've been able to look at the transmission of adult attachment patterns over to children. Daniel Stern's also written about the transfer of relationship patterns in his book, The Motherhood Constellation. And so within the field of early childhood mental health, the transgenerational transmission of relationship patterns, or particularly trauma, has been a sort of a well-established conceptual framework for understanding parent-child relationships and how things are occurring within those relationships. But within the field more generally of child psychotherapy and mental health generally, this understanding of the transgenerational transmission of relationship patterns has received less recognition because of how we go about training mental health professionals. For the most part, we train psychotherapists to work with adults. Then, if the therapist wishes, they can receive additional training in how to work with children. And that training typically takes one of two different forms. Either they're trained in play therapy, which involves the idea that if the child is allowed to sort of non-directively free play in the therapy session, the child will sort of magically work out their issues and self-actualize in their development. And the other approach that we train child therapists in is sort of a variant of behavior therapy. I would classify it sort of as a parent behavioral training. So it's not as rigorous as behavior therapy, but it essentially involves rewarding good behavior, punishing misbehavior, and extinction practices of removing the reinforcement from misbehavior. And so it's a variant of behaviorism that involved how to modify the behavior of lab animals in research in the 1940s and 50s. So those are the two primary child therapy approaches we currently adopt. Very few child therapists are actually trained in the research on child development. In addition, very few clinical child therapists are actually trained in the neurodevelopment of the brain during childhood. Whereas if you then specialize in early childhood, these are essential training areas for an early childhood mental health professional. Because during that period from 0 to 5, the brain is undergoing rapid changes and rapid development of various brain systems. We have language acquisition, emotion regulation systems are coming online. The parent-child relationship is paramount in transferring some of the regulatory software from the more mature adult nervous system to the child's nervous system. So the relationship systems of attachment bonding, as well as a secondary system, or a second system involving psychological connection. It's called intersubjectivity, that uses a set of brain cells called mirror neurons. These relationship systems are paramount. And so because early childhood is a period of rapid brain development, it's essential that early childhood mental health professionals understand child development, and particularly the neurodevelopment of the brain during childhood, and how that's mediated through the relationship the child has with the parent. And so because of this, early childhood mental health professionals have an understanding of how relationship patterns are passed on neurologically from one generation to the next. Whereas most child therapists, because they don't receive this background training, don't understand this process. And so, because I have a background in both attention deficit hyperactivity disorder, angry oppositional kids, but also in early childhood mental health, when I began to work with the alienation process, I fairly readily recognized the transgenerational transmission of trauma that's occurring. And so that's what I'm going to be discussing in this set of video segments. However, if you take this information out to most practitioners, most mental health therapists, they may not understand the concepts involved because they've never received the training in child development, and particularly the neurodevelopment of the brain, necessary to understand or recognize these concepts. Now, personally, I believe that's problematic. I think if you're working with children and families, you should understand child development and the neurodevelopment of the brain during childhood. I think that's foundational to competent professional practice. But currently, within our current training models, it simply is not part of the training that we provide to child therapists unless they seek out additional training in early childhood. Most professionals who do seek out training in early childhood tend to be infant folks. They focus on the parent-infant relationship, and that's what got them into early childhood mental health. And so they generally don't come back out to work with older kids. They're mostly focused on the parent-infant relationship. Because of my background in ADHD, I got into early childhood to work with attention deficit hyperactivity disorder, so my focus is more on the preschool age range. But I understand infant development as well. When I was a clinical director of an early childhood assessment and treatment center, I supervised both the infant side as well as the preschool side. But my real focus is more on the preschool age range in early childhood, but also taking the neurodevelopment and child development research regarding the brain development during childhood and applying that to older children as well, the 7, 8, 9, 10, 11, 12, and even adolescents and even couples, related to how the brain works, how the brain grows and develops, relationship networks, emotion networks, motivational systems, things like that. And so in the next few video segments, I'm going to be discussing how the parental alienation process originates in the early childhood experiences of the alienating parent and how it's being transferred and expressed into current relationships.